Hello guys, welcome to my YouTube channel Let's Join Pharmacy. In this video, let's discuss about the typhoid. Actually, what is this typhoid? Causes of this typhoid, it is a bacterial disease. Then symptoms, diagnosis for this typhoid, treatment and vaccine. Everything you will get in this video. So no need to watch any other video by watching this video. So my request to all my subscribers and those who are clicked to watch this video, watch the video until last to get the full knowledge. Actually what happen, you have to gain the full knowledge. Half knowledge is the devil's knowledge. Understand? If you know half means really one day it going to kill anyone. So because getting a full information is very important. Either you get here or from any other video, but you watch the video until last if you like that video. First let's discuss what is this typhoid. See my dears, typhoid, it is also called as enteric fever. Typhoid, it is also called enteric fever. It is caused by the Salmonella typhi bacteria or the Salmonella species of the bacteria. It is very important, you have to understand. I have discussed, you remember one thing, bacteria can be treated by the antibiotics, but the viruses can't be treated by the antibiotics. Okay, for the viruses we have to give some of the oral supplements, like we have to increase the fluid diets. We can give some of the multivitamins, especially those which contains the vitamin C, zinc, okay, and folic acid. These minerals we have to increase, where in case of viruses. In bacteria also same, but in addition to that we are giving here some of the antibiotics which will kill the bacterial growth. Typhoid fever is rare in places where few people carry the bacteria. It is also is rare where water is treated to kill germs and where human waste disposal is managed. It is more in Africa and South Asia part. Remember one thing, where there is a unhygiene, there will be typhoid, because these bacteria will be spread because of unhygienic condition, because of unhygiene water, waste water, disposed type of the things in the water. These all conditions provoke for this bacteria to grow. And actually what happens, this enteric fever, mainly it will manipulate in your small intestine, mainly, okay, small intestine, and in the oral cavity. If anyone asks you where does the Salmonella typhi grows maximum, means you tell him in the small intestine, in the gut cavity. Causes a bacteria strain called Salmonella typhi. You are observing here, this is a Salmonella typhi bacteria. Causes typhoid fever. Uncooked food from water drinking, then unpasteurized milk, okay, this type, and raw material, raw food also causes this typhoid fever. These are the some simple causes. Symptoms, if you discuss, means symptoms are likely to start slowly. Okay, basically when typhoid attack to you or the Salmonella typhi bacterium attack to you, they won't show immediately the symptoms. Initially it goes inside our human body, it has to fight some with the some of the immune cells, then the immune cells will show the response. After showing that, the first or third weeks after the symptoms will show, up from first to the third weeks after exposure to the bacteria, either they will show after 7 days only, after 7 days. Early symptoms include, one of the major symptom in typhoid is a fever, that is 104 degree Fahrenheit or 39.8 or sometimes 41 degree Celsius, it is the temperature. Chills, means you will feel some of the chilling nature, coldness in our body, then headache, severe headache, weakness, fatigue, diarrhea. I told you, because of infection of the small intestine, diarrhea it is common, constipation, then rash also very common here, rash also very common, and mainly rash on the trunk region. Here on the trunk region you will see the rash, or on the abdominal region, on the upper side of the stomach you will see the rash. Then severe stomach pain also you will observe here, where in the typhoid. Then late symptoms, what are the late symptoms? A few weeks, after 2 weeks or 3 weeks, the patient will suffer from very swollen stomach, very small swollen stomach, like in hepatic diseases, okay, in liver problems, what you observe, like that condition will occur here. Then sepsis means this one. Sepsis means it is an autoimmune disorder where the immune cells will kill their own cells. Okay, sepsis means breakdown. Then confused, unable to mingle with the society. These all are the these are the late symptoms. If you observe these symptoms immediately you have to admit to the hospital, because there the doctors, the nurses will supply some of the important fluids through the IV, because at that time the tablets, the suspensions, due to the very slow route of administration of these drug, they are choosing the IV route, like they are giving some of the DNS, then some of the different type of the antibiotics through the IV route. That is very important. See, you have to go to the hospital. Diagnosis, very important. Diagnosis, see, medical and travel history. First your doctor will ask, did you ever visited the place where is a more typhoidic environment? Okay, they will ask this type of the questions. And next one is tissue culture. It is one of the very important diagnosis. Tissue culture, here what they will do means they will culture the bacteria for 3 days in a separate media, in isolation media. In a microbiology lab, what they are doing means they are culturing this bacteria. After 3 days, what happens, if your blood, if your tissue contains the bacteria means they will grow on that culture plate. Here you are observing, no, they will grow on the culture plate. This indicates that you are having the typhoid fever, and it is one of the very accurate method to determine the Salmonella typhi bacteria, very accurate method. Then another test for typhoid DNA in your blood, Vidal test. See, many doctors they are performing this Vidal test. Actually, not highly recommended doctors or highly super specialist doctors or super specialist doctors are prescribing this Vidal test. Why? Because these tests are not accurate. Some of the BMS doctors or those they do not have more knowledge on the diagnosis, they are giving this Vidal test to diagnose. But actually Vidal test, it is a not accurate test. It is cheap, but it won't give you correct information. But tissue culture or blood culture, it is one of the very important accurate test. They may cost 1200 to 1300 rupees. Sometimes it goes for the 1500 also, but they will give you accurate results, and the results will get after 3 days. After 3 days only you will get the report. Okay, but this Vidal test, evening only you will get result, but you cannot go directly for the Vidal test. You have to wait until 3 to 4 days, minimum 4 to 5 days you have to wait, then you can go for the Vidal test. Your doctor won't directly give the Vidal test. First he will give some of the painkillers, or he will give some of the antibiotics, then for 4th to 5th day he will give Vidal test. Okay, but in this tissue culture or blood culture, what happens here, they will directly give the tissue culture, blood culture test. Here after 3 days the bacteria will grow in the separate culture, so that the doctor can diagnose and he can give the accordingly treatment. Next, the treatment, one of the very important. For this you all are here. See, maintain good hydration. It is very important. Any disease you take, either may be it is a viral disease or bacterial disease, hydration is very important. Water hydration, minimum you can drink water. Okay, and water in this typhoid especially, warm and cool water is very essential here. Then some of the ORSL or saline if necessary. Doctors will prescribe hospitalized in a hospital, they will give some of the saline, NS 3%, 9%, 6%, is all. Vitamin C supplement daily one, very important. Antibiotics is effective treatment in typhoid. Some of the antibiotics like ciprofloxacin 500 mg 2 times in a day, cefixime 2 times in a day 200 mg. Okay, according to the doses, according to the body weight, the doctor will prescribe any one from this antibiotic. Clavum 625, that is amoxicillin, it contains amoxicillin and potassium clavinate. Then azithromycin, cefixime and ofloxacin, it is a dual antibiotics which having the greater capacity to kill the bacteria. Okay, cefixime and ofloxacin, that is in a BD form, BD. Then treatment with antacid or analgesic depend on the symptom. Okay, some of the antacids are given, gastric tablets also they may give, or some of the analgesic also they may give. If you are having the pain means on the depend on the symptoms, they will prescribe some of the other medicine. Like if you are having the running nose, they are giving some of the chlorpheniramine or phenylpyrine with the combination of the paracetamol. In basic they will give Synarus tablets. Then antacids are given to prevent stomach upset. But these tablets, there is a situation of stomach upset, a burning sensation in the stomach, so doctors may prescribe this one antacids like pantoprazole, proton inhibitor, these all are, they will prescribe this one, and or ranitidine, omeprazole, etc. Yes, this is a treatment. Our last is vaccines. See, vaccines are already introduced for this typhoid. You can give this inactivated 6 polysaccharide vaccine, or Typhi 21, that is 1 capsule by mouth, 4 number of doses, 4 taken every alternative day. Then Typhem 6 from a Sanofi Pasteur, it is a vaccine, it given once, okay, once. When these vaccines are given, if you are entering the places where there is a high prone to typhoid or some of the typhoid prone areas, or already if you have overcome through the typhoid disease, means these vaccines are giving, because they will be protect you from the typhoid bacteria. Actually it is a not a 100% treatment, but what they will do, they will improve their immune cells to defend from the bacteria, double power by this vaccines. Now first time they get experience, second time they know what to do if the bacteria attacks. This giving experience is by these vaccines only, and fighting against that bacteria by means of our own immune cells. So you have to maintain good hydration, very important one, taking some of the important supplements, vitamin C, very important, zinc tablet, very important, according to the doses, okay, not for a prolonged use, according to the doses on the basis of your doctor, it is very important. Yes, this is the very important video on the treatment, diagnosis, symptoms, causes, and what is this typhoid fever. So if you like this video, subscribe our channel Legend Pharmacy and turn all the bell icon, okay, and also like the video. And if you want any information, you can ask me in the comment section. Thank you.